Hello, I'm Dr. Emma Loucks for the Texas Medical Association. In this video, I will describe how diabetes can affect your eyes and how to prevent diabetes from hurting your vision. Nearly 26 million people in the U.S. have diabetes. It is the leading cause of blindness among adults between ages 20 and 74 years old. As a diabetic, you should work with your medical doctor to control your blood sugar, your blood pressure, and your cholesterol to help make sure diabetes doesn't cause even more damage to your body. Quitting smoking and exercising also help quite a bit. How does diabetes affect the eyes? The disease can damage the retina, which is in the back of the eye. It acts like the film in a camera. The retina creates an image of what you see and sends it to the brain through the optic nerve. Over time, patients with diabetes whose blood sugar is not controlled will suffer damage to the small blood vessels in the retina. This damage is called diabetic retinopathy, and it can cause blindness. Luckily, your eye doctor can find and treat it before the damage gets that bad. Diabetic retinopathy can appear in two different ways. In the first way, the blood vessels in the retina leak fluid. This leakage can cause swelling of the area of the retina used for central vision. This swelling then causes decreased vision, which can lead to blindness. There is another way diabetic retinopathy can hurt your vision. This happens when very tiny blood vessels in the retina close off. These little blood vessels bring oxygen to the retina, which needs more oxygen than any other part of your body. When diabetes closes enough of these small blood vessels, the retina is starved for oxygen and produces something called Vascular Endothelial Growth Factor, or VEGF. VEGF causes new blood vessels to grow in the retina. The new vessels are very fragile and can bleed into the eye, causing severe vision loss. An ophthalmologist is a medical doctor who provides medical and surgical treatment for the eyes. He or she can examine your retina to decide if you have diabetic retinopathy and then treat it before the condition affects your vision. You can have excellent vision and still have diabetic retinopathy that needs treatment. The only way to make sure is to have a dilated eye exam. During your eye exam, drops are placed in your eyes to enlarge your pupils so the doctor can see the entire retina. Diabetics need to have dilated eye exams at least once a year. Pregnant diabetics need to have those exams more frequently. If you see new floaters in your field of view or your vision decreases, you should see an ophthalmologist for a dilated eye exam. Early treatment of diabetic retinopathy prevents vision loss. We now have anti-VEGF drugs that give us a great new way to treat this disease. But to take advantage of these treatment advances, you need to have dilated eye exams. Your ophthalmologist will go over your exam results and discuss whether or not you have diabetic retinopathy, and if so, what treatment options are best for you. Thank you for watching, and I wish you good health.